country. Dr. Loveleena, if I can begin by asking you, as a gynecologist, we've just heard from the women, so I want to begin by asking you, how important is it for women to be aware that, you know, a dreadful disease like cancer or any other can actually come knocking now much earlier?
Yes.
It's not like you have to be quote unquote careful after you're 50 or 60. It can happen a lot earlier.
You are right, Rishika. We are seeing that cancer is striking at a lot younger age, and the cancers which happen at a younger age are more aggressive and they are fast growing. So it is very important that every woman should be aware of all these cancers, and breast cancer is the most common cancer in India, and as a gynecologist I see cervical cancer, that is mouth of the uterus, that is the cervix, that is the second, and followed by ovarian cancers and other cancers. So as one of the survivors said, breast awareness is very important, and yes, self breast examination goes a long way, in knowing whether you are okay. One can look at the size and shape of the breast, look for any lumps, any thickening, any nipple discharge or anything unusual. One should go to a doctor,
right,
and the doctor should be doing a clinical breast examination to find any positive things.
Okay.
And of course, because it is striking at a younger age, so now the breast screening starts at 30 years,
right,
and ultrasound is done from 30 years to 40 years, but mammography is the best tool starting at 40 years till 79 years or till the health permits.
Okay.
But in case there's a family history, your mother or sister has had breast cancer, especially in a premenopausal phase. So the age at which they got, the screening has to start 10 years earlier. So, and this is the latest guideline by Radiological Society of North America and Breast Cancer Society of India.
Okay. So I think this is very important information, hopefully, that viewers can use while you're hearing of, breast cancer being the most common. There are tools that are available to people like you and me, which is essentially early screening and awareness, and Dr. Nadir has, I think, dispelled a lot of that information.